Welcome to JRTV. Now we can discuss about recession of gum tissue. The gingival tissue, in some cases, some patients, there will be recession of gum. Means the root portion of teeth, especially canine teeth or front quadrant of incisors and premolar teeth. Sometimes the first molar, second molar, third molar on right side and left side, and lower mandibular, first molar, second molar, third molar on right side and left side, the roots will be visible. Means the gingival attachment, the attachment onto the root surface will be low down because the recession, because of some habits. Some people will have tobacco chewing habit, pan chewing habit, and betel nut chewing habit, and pungent nut powder chewing habit, and even this neem sticks chewing habit also will results the detachment of the gingival tissue to the apical area of root. Means the joint between the tooth surface to the gum is gum fossils. The joint will be recede towards apical portion of upper teeth, either upper teeth or lower teeth, is called recession of gum tissue. So many patients they use to brush with hard brushing. Hard bristles. The brush contains hard consistency bristles. In that cases also, while brushing of teeth, the maxillary teeth and the mandibular teeth, they will forcibly brush the teeth, so that in that cases also the gingival tissue become reside, and the joint may change up to a root portion. In these cases, the patients, most commonly the patient will complaining of this sensitivity of hypersensitivity of teeth towards hot water, cold water, and even citrus fruits and juices and sweeteners can't take orally, because the root exposure in this gingival recession, the root will be exposed, and there will be a detachment of this gingival tissue onto the coronal part of this premolars, molars, and upper and lower front quadrant of incisors. So there will be mobility of teeth. In these cases, the hard consistency, extra hard consistency, and muscular food, this non-vegetarian food can't chew. The patient will complaining of pain while chewing this medium consistency, hard consistency, and extra hard consistency food while chewing or grinding or mastication is very difficult, because the roots will be exposed, and there will be hypersensitivity of this molar teeth, exposure of all the root surface area tend to become more sensitivity towards cold water. The patient can't take ice creams and frozen food and these hot coffee, tea and this green tea, all the hot preparations, even juices, even cold these frozen juices and these soups also, mutton soup and chicken soup and mixed vegetable soups and corn soups, whatever it may be. The patient can't take inside because of this hypersensitivity of hypersensitivity of teeth because of this recession of gingival tissue. So in chronic periodontal infections tend to cause this recession of gingival tissue because of excess deposition of this calculus tartar and hard consistency food impaction, because the food impaction becomes more like a concrete structure, just like cement and cement. If you add water into the cement, it becomes so much of hard. Like that, these food particles, the stagnated and impacted food particles in between the interdental spaces and onto the coronal part of this premolars or molars or upper quadrant and lower quadrant incisors may become a concrete structure, and this plaque or tartar or calculus will recede this gingival tissue towards apical region. So this is the concrete structure. It will eaten away the gingival tissue to recede to the apices of these upper quadrant roots or molars or premolars, whatever it may be. So food habits has to be improved, and oral hygiene has to be maintained in healthy and oral prophylaxis should be clean and neat and hygienic. So periodontal specialist, MDS periodontal surgeon will keep the patient's oral cavity in a good condition, good oxygenated condition, good rejuvenated condition, good it will pinkish healthy gingival tissue will obtain by visiting dentist, and dentist, the periodontal specialist will clean the tartar or calculus or this food debris will be removed by physical vibrations of particles of matter by cavitron, and the gingival tissue slowly it will improve to attach up to the coronal part of this premolars or molars or canines or the upper quadrant of incisors teeth. So the food impaction under the concrete calculus and this tartar will recede the gingival tissue and it will dislodge because of this hard consistency. Concrete structure will always detach the gingival tissue onto the tooth surface. So the detachment in chronic suppurative periodontitis, there will be pus, there will be exudation of pus from the gingival crevices and interdental spaces because of this concrete irritation of this calculus or tartar or this hard concrete structure because of food impaction in between the gingival tissue will eaten away the because of soft tissue. If the soft tissue is in continuous contact with the hard tissue, there will be recession or attrition or abrasion. So the gingival tissue get recede, and the attachment that gum forces will be dislodged because of this concrete structure of calculus or tartar. So the periodontal specialist beautifully he will remove remove the calculus and the tartar by physical vibrations of particles of matter by cavitron. It is a highly sophisticated instrumentation without any enamel loss or dentin loss, and the hypersensitivity of these upper teeth and lower teeth will be minimized by applying desensitivity, applying the desensitizer paste by Cavison or Sensoform or Hemoform, because formalin content paste will decrease the sensitivity of this teeth towards hot water, hot tea, coffee and green tea, and any frozen items, ice creams and frozen food, frozen soups and drinks, and even this citrus family juices also, because citric acid and ascorbic acid also enhance the etching of further etching of this enamel, and patient becomes more sensitive towards this soft consistency food or even sweet or sour, because salt, sweet and sour, he is very sensitive to these all the tastes of sweetness and bitter and sour and cold frozen items, and these frozen items and even hot drinks and drinks, coffee, tea and this green tea also. So the recession of gingival tissue will be terminated by doing a hand scaling or by this by highly sophisticated instrumentation by cavitron, so that the attachment will regain to the coronal part of these incisors teeth and premolars and molars of right side and left side, so that the patient will so much of happiness towards this sensitivity of teeth after this scaling of deep scaling of this removal of this concrete tartar or calculus from coronal part of these tooth surfaces of 32 teeth in and around in the palatal region, interdental spaces, and in the buccal region and the labial spaces and the lingual spaces inside and outside. The tartar will be removed, and the gingival tissue become more attachment onto the coronal part of the maximum circumference of teeth, the coronal part of all the teeth, and the attachment will be more firm, and patient will have relief from this sensitivity of teeth. So and mouthwashes, Listerine and Hexidine and Cavison and Colgate and betadine oral mouthwash will be very useful because of dilution. అయిపోయిందా ఎంతసేపు? ఓకే, అది లాస్ట్లో మీరు కలిపేసేయండి. సో the mouthwashes will improve the oral prophylaxis of patient's oral cavity, and it will improve it will kill the harmful bacteria in the oral cavity, which will be the causative factor for halitosis. So the mouthwashes will be more useful for decreasing, for minimizing halitosis from the oral cavity. Thank you so much for watching JRTV, signing off.